to the covering of the heart. So the covering of the heart is known as the pericardium. ठीक है? So this pericardium is known as the fibrous pericardium. So the inner lining of the fibrous pericardium, it is covered by this part. This is the parietal layer of serous pericardium, and the whole of the heart, it is covered by this sheath-like structure. See, this sheath-like structure, which is known as visceral layer of serous pericardium. Now coming into the blood supply of the heart. So the blood supply of the heart, it is divided into right coronary artery and the left coronary artery. Okay? So there is a sinus, the semilunar valve. We have two semilunar valves. One is the aortic valve, one is the pulmonary valve. So only the aortic valve will give rise to the right and the left coronary artery. So first we will discuss about right coronary artery. Okay? So within the aortic valve, we have three sinuses, three dilatation, one anterior and two posterior. Then two posterior is again divided into left and right. But only the left will contribute to the formation of coronary artery, not the right one. So the right one, it is actually it is also known as, because it is not taking part in the formation of coronary artery, so it is also known as non-coronary sinus. Okay, whose bulge we will see in the right atrium as torus aorticus, that we will discuss later on. Okay, so now coming into the blood supply of the heart. See, this is the right coronary artery. Can you see? This is the right coronary artery. Okay, so this is the arch of aorta. This is the pulmonary trunk. So this right coronary artery, it will come from the anterior aortic sinus. है ना? So it is coming from the arch of aorta. Then it will lie between the pulmonary trunk and arch of aorta. Then it will go into the AV groove. है ना? This is the AV groove. This is the right AV groove. ठीक है? Then it will come. Then it will reach the inferior border. While reaching the inferior border, it will twist behind, or it will wind behind to reach the crus of the heart, where it will anastomose with the circumflex branch of left coronary artery. Okay, so this is the right coronary artery. Okay, so this right coronary artery then will go into the posterior interventricular septum or the groove as posterior interventricular artery. Okay, and on the margin, before giving this branch into the groove, it will give a branch to the margins. This is known as the right marginal artery. Good. Okay. Now we will come under the left coronary artery. So this is the left coronary artery, which is coming from the left aortic sinus, posterior aortic sinus. Okay. Now first it will be dividing into two branches. Okay, so this branch is also known as, this is going into the anterior interventricular groove. This is known as anterior interventricular artery. For you people, you will say it is anterior interventricular artery. Only the clinicians use the term LAD, that is the left anterior descending artery. So ये दो पार्ट में डिवाइड हो गया. एक क्या बनाया है? लेफ्ट ये posterior interventricular artery, and the other one will go behind in this coronary sulcus. Okay, this is the posterior AV groove. This branch is known as the circumflex branch of left coronary artery, which will anastomose with the right coronary artery. Good. Okay, now again this is the posterior anterior interventricular artery. Anterior interventricular artery and posterior interventricular artery will again anastomose in the inferior diaphragmatic border of the heart. Okay, and again this is the left coronary artery, major branch. So this left coronary artery will again give a branch to the margins. So that is known as the left marginal artery. That will give branch to the left border. Similarly, right coronary artery will give branch to the inferior border of the heart. Okay. Now one more thing is this. This is the pulmonary trunk. Okay. So the right coronary artery and the left coronary artery will also give branch to the infundibulum. This is the outlet. Inside there is an outlet, or otherwise known as the outflow tract of the right ventricle. So that is also known as the infundibulum. So infundibulum, inside it is known as infundibulum. Okay, that infundibulum is otherwise also known as conus. Okay, so this outlet of the pulmonary trunk will have branches from both right coronary artery and left coronary artery. They are known as the right and the left conus artery. Again, you will have small atrial and the ventricular branches. Okay, and you will also have diagonal branches. Okay. Now coming into the interior of the heart. इसको बंद करो, अभी इंटीरियर में आएगा.